I'm Eva Hasbrook. I'm from Casper, Wyoming, and I feel good.
Good. And surgery went okay.
Surgery went okay.
Now, we had a big fear with you because you are on oxygen.
Right.
And asthma.
Yeah, COPD.
And COPD. And so one of the worries is if you're seriously ill when you come to see us, well, COPD and asthma, walking around carrying an oxygen tank, that's...
I feel like I'm frail, but
well,
I guess there
but
is
that's no kidding around. You know, carrying an oxygen tank around, it's not like just having asthma.
Right.
So we had a healthy respect for the seriousness of your surgery. And how did it go?
Great. They came and gave me a breathing treatment and stuff before. Right. I felt good.
Yeah. Well,
we were
very proud of that. Again, anesthesia can be very serious, and I think we were actually in clinic a couple of last Tuesday, and we had a gentleman who was here visiting, and he talked about how his friend had an anesthetic complication. Yes.
That's the friend.
Oh, is that okay to talk about?
Yes.
Well, we heard your story, and you had some kind of surgery, nasal surgery, and woke up in a coma for a month.
Yeah.
Yeah, or maybe you should say didn't woke up. So everybody here was frightened after your friend told us about that. And so I had like 20 people scheduled for surgery who all walked out. But we do take it very seriously, and we talked about the anesthetic techniques that we use are different and things like that. And that was really educational. I hope you don't mind that we've used your experience, not your name or anything like that, but that experience of going to sleep as a heavy person is really serious. And especially as you get bigger, especially as you get worse lung disease, needing oxygen, and COPD, they increase the risk. But what we said last week when we talked about it is we use a very specialized anesthetic technique, which is much, much safer for you. And we had a number of people last week, and you probably talked to other patients of mine who did great. We have Rory here from Chicago, who is a great big guy. He had surgery with us how long ago now?
6 weeks.
6 weeks ago, and your surgery, anesthesia-wise, went great?
Yeah.
Is it all right just to mention how much you weighed at the time of surgery?
42.
Pardon me?
42.
So we're happy you went through it safely. Also, because when I was standing next to him, I was going, are you okay? Are you happy? No. Questions? Anything?
I felt good. My biggest issue was the nausea.
You had a terrible nausea right after surgery, and then we gave you some medicine?
Well, they kind of gave me medicine throughout the night, and then finally somebody said, well, are they giving you the cocktail? And I go, I don't know. They came in like a herd of, I was like, it was gone. I had nothing since, you know.
So here's something for all of you who are about to have surgery. If you get nausea post-op, we have kind of the usual suspects, the nausea medicine we usually give, and that usually takes care of it. If, though, that doesn't, tell the nurses, I want Dr. Rutledge's cocktail.
See, and I didn't think of those words, and I wish, because they gave it to me like the next day.
Right.
But as soon as they gave it to me, it was like,
it's magic.
Yeah, it was like everything was gone, and I haven't had any nausea since. But it was the first thing was when they wake you up, they said, do you have any pain? I go, a little, and I go, I'm nauseated, and that's all I remember, so.
Right. Other questions that we can answer for you? Or Sis, is she doing okay? Does she need the
yes,
patching?
yeah, estrogen question goes to her.
She's doing okay?
I'm fine. I really don't feel any different. I mean,
You look great, and
the
she's
only
doing
thing,
okay?
Friday I didn't expect, my shoulders and my tops of my legs were like stiff, like I was climbing up a ladder and painting or something. But I went to a craft fair. The only problem was sitting and standing, just between the two motions. But other than that, I felt good. We've been busy. If I'd been home, I might have stayed home.
But you were taking in the tourist sites and things like that?
You're sitting in a hotel room. You know.
But I think the thing I was going to emphasize is you had major surgery and you're out doing stuff, you know, like
we got out Thursday afternoon.
Right.
We went to the craft fair on Friday, went to Hoover Dam on Saturday, went to Menopause on Sunday, went to the Cactus Gardens yesterday, going home today.
That's pretty cool.
Yes.
That's pretty cool. We're proud of that. Can I take your staples out?
Sure.
All right, thank you.
They're kind of red.
That's just, it's time. Your body is saying that piece of steel needs to come out of my skin.
See, my grandkids are going to be like they thought I was coming here having surgery and coming home skinny.
Yeah, like you're a balloon.
Yeah, and I go, well, no, I'm not going to come home skinny.
Dr. Rutledge just wasn't that good.
Not even bruises to get sympathy from.
Okay, applause. Do you feel like being on TV for the whole world to see? All right, here we go. And